knees and sit down, please. Get your knees around here.
Good evening, friends. We meet after, as Ajay said, after an unjustified break of what, 3 months, 4 months. And, but we're still keen that we should take this ahead. I first apologize for the delay or the break in the last 3 months. As you are aware, Manthan is an open group for debate, and we're glad that today we have Dr. Bhargava. Ajay will speak on this. But one of the things I wanted to ask you is to expand the size of this group, to start telling people about this, and we want more people to come into this group to talk about the issues which we are planning to discuss. And we hope that in the next meeting, which actually one we scheduled for the month of July, we'll have more people here who are discussing these issues. I've been asking someone to speak to us on the reservation policy. I'm sure it's a hot subject. Dr. Bhargava himself has done quite a work on that. But today, we'll not talk about that.
Thank God. Talk about it all these 5 weeks.
So, next month, what we want to achieve, talk on reservation policy. But more important, I want all of you to start talking to your friends, and those small email lists which we have, I hope will hit some attractive number like 200 or 300, so that more people can get into the debate, and we can have a little more informed debate on what we are going to discuss. I also want some volunteers or someone who do some work and start distributing some information on a topic like this. We don't have enough people to do that, and that's been the aim of what we and Ajay are planning, that whenever there is a topic like this, what we should do is that at least distribute facts. Someone who can do some research on this and say that this is how, this is the position of philosophy, or this is the position of homeopathy, this is where we are. Some material there, so that all of us know that this is the current debate which is going on. If I get volunteers for that, I'll be glad to work with them. May I ask Ajay to participate in this program?
Good evening and a very warm welcome to all of you. Dr. Bhargava, we formed this group last year with an intention that we get together on a periodic basis and learn from people like you on a variety of subjects. The idea is that there aren't too many forums for public discourse, and learning, debating, and dialogue were the essence of what we wanted to do. Today's meeting, we will have one of the finest scientists, thinkers in this country to talk to us on a subject that I had thought was very important for us to hear about, understand, and root about. I had known that Dr. Bhargava had taken a stand on some of the issues that this subject would have, and I thought there were very few people who were clear about what it should be and it should not be, and I was very, very happy when Dr. Bhargava said yes, he would come and talk to us on alternate systems of medicines, what they should be, what they are, and what they should be. We are extremely thankful to you, Dr. Bhargava, for having accepted our invitation and coming to us. It's not very often, friends, that we can have a person of the stature of Dr. Bhargava to come and talk with us. What he has achieved so far in his lifetime is a fraction of that most of us would not even dream of achieving. That's the caliber of the person that's going to talk to us today. A person who is a foremost scientist in this country. He was the founder director of the Center for Cellular and Molecular Biology, CCMB here, which has become one of the premier institutes of the country. He is himself regarded as the architect of modern biology and biotechnology in India. He became a PhD at the age of 21. He worked in the USA, UK, France, Germany. He has traveled to over 60 countries. He has delivered over 250 invited lectures in 125 institutions outside India. And he has given talks at about 1600 invited talks in India. Over 125 major publications and 400 other articles and write-ups on several subjects are to his credit. He has been given over 100 major national and international honors and awards. These include the Legion d'Honneur from the President of France, the Padma Bhushan from the President of India, the Fellowship of World Academy of Arts and Sciences, the Fellowship of National Academy of Medical Sciences, and a long list of such absolutely top-class honors and awards is what Dr. Bhargava has received. He is the past president of the Society of Biological Chemists of India, the Indian Academy of Social Sciences, the Society for Scientific Values, the Association for Promotion of DNA Fingerprinting and other DNA technologies. I can keep reading all that is to his credit, and it's amazing that a person could achieve so much in such a short time. He is currently the chairman of the Medically Aware and Responsible Citizens of Hyderabad, the Sambhavana Trust at Bhopal, and of Basic Research, Education and Development Society. He is the vice chairman of the National Knowledge Commission, which was set up by the Prime Minister earlier in his term, with an intention of converting this country into a major knowledge base. He is an advisor to several well-known pharmaceutical and other industries, has been a chairman of several companies and is a director of various companies. Above all, he is a person with the sharpest mind that you can think of, great humility, and a very, very fine person. It's very unlikely that we'll meet a person of the kind of Dr. Bhargava very often. I'm indeed honored that is with us, and he'll speak on a subject that we all need to listen to. I'm fairly sure we would want to have him around once again on several other issues that he can talk to us with his knowledge and his experience. And I'm sure he'll agree to come and talk to us soon, sometime soon, at his convenience. Friends, this is an evening, and I'm sure all of us will enjoy this evening with Dr. Bhargava. Thank you very much. And because of the knowledge, please offer a bouquet to Dr. Bhargava as a matter of welcome. Dr. Bhargava, would you like to say it or would you like to?
Okay.
West I'm delighted to be here with you. It's such a lovely view. So I have two distractions, left side and in front. So forgive me if on account of these distractions I lose track. I was saying is get back. I want to begin by sharing with you.
Back up volume.
Oh, that's not working.
I want to begin by sharing with you a dialogue that I had years ago with Jonas Salk, who discovered the first polio vaccine that gave so America's island in some ways. We did the following exercise. We got together whatever data we had about growth of human population. As perhaps most of you know that most scientists, most of us, today believe that we all here elsewhere, irrespective of the garden creed, are progeny of a single woman who lived in Africa some 200 last years. Man has been on our planet for much more than a period. But that doesn't happen when the other lady just died. Only one lineage survived. And it might amuse you that though all the evidence says we are progeny of one woman, but we are not the progeny of one man. You can now derive your conclusions from this statement. So given that situation, we map the growth of the population, given all other evidences, we came to two very interesting conclusions. First was that if mankind did not have any way or ways of curing some ailments with which we have suffered all through history, we would have been extinct by now like dinosaurs. The fact that we are there means that we did have some means of curing some diseases. That's what we call traditional medicine. Then, if we did have a means of curing all the diseases that we can cure today, if we had these means with us all through history, even in the last few thousand years, since the advent of recorded civilization, we would have reached today's population of 6 billion. Maybe several millennia ago, if not 1,000 years. What does this mean? What this means is that we did have some ways of curing some diseases, but not all diseases. This is also very clearly implied by the rise in the average lifespan of human beings. In our own country, the lifespan, I was the age of some of my young friends I see audience, was only about 23 years. And today it's over 62 years in our country. In Japan, the average lifespan for a Japanese woman is close to 85. How has this, or how did all this happen? Clearly this has happened because we have acquired new ways of curing diseases that didn't exist anymore. The credit for this must go to modern medicine, just as the credit for allowing us to be here today must go to traditional medicine. As I said, if we didn't have cures for anything at all, we wouldn't have survived, we would have been extinct. So we must dismiss traditional medicine totally. But we must dismiss modern medicine either. First point that we must recognize. Now, how has modern medicine come to have this very interesting situation? unfortunate situation that a vast number of diseases we have not problem. This is caused by microbes, tuberculosis. Today it's a rare person died of tuberculosis. We are cured. In my family, at least one person, my maternal uncle died of tuberculosis because there was no cure at that time. I'm talking of the 1930s, 1940s. Smallpox has been eradicated from the planet, which was a big killer. Cholera has been controlled, plague has been controlled. Many countries in the world are free of polio. And later, we can today have people who have a coronary problem live a completely normal life. And so is true with a large number of other diseases. And that has been because modern medicine has provided us with this. You must remember that traditional medicine could not take care of this. It is the modern medicine which has been responsible for the health of the people as we have today. It is very unfortunate that the means that modern medicine provides to us today are not equitably distributed. Medicine has become, instead of being a service sector, has become a commercial sector. When I was young, the two people who were respected in the community were the doctor and the teacher. We have commercialized education, we have commercialized medical. And we are accepting in a few countries like Britain, where we have national health service, which I think is a fantastic idea. So let's just spend a few minutes to look at how it's done. Now, this is not absent of history. It all, this chain that led to this situation, the seeds of this chain were so in the 12th century, Manthan, who was the first one, but and then talk about what today all the method of science, all the experimental method, where you did an experiment. The idea of experiment is so common to us, and we accept the experiment, we simply didn't exist. Nobody did an experiment. He was the first one to talk about this. I will not go to the history of the method of science in fact, we had a TV program on this in the 1970s. I will show that the history of the evolution of the scientific method. That's the history the method. And then this method was given new dimensions, new directions by a course of machine, who in a way was the person who laid the foundations of what we today know as Buddhism. New age. And we call it Buddhism because at that time everything flourished. Literature, painting, sculpture, science, architecture, engineering, everything flourished in religion. If this method of science, the scientific method in which you make observation, analyze existing information, and ask a question based on this observation, answer this information, then you make hypotheses which would be possible answers to this question. Your hypothesis must be tested. And you test each one of these hypotheses by making predictions, doing experiments. Saying if this hypothesis is correct, if I do this experiment, then the result will change. If I don't get a result, I change my hypothesis. This is what we do in scientific research. And then if we cannot think of any experiment which will disprove the hypothesis, which we haven't done, and the hypothesis is not disproven, then we say this hypothesis is my answer. That's how scientific operates. It's how it happens. I wonder how many of my Protestant friends recognize that they were no Martin Luther if they were no Leonardo and no Baker. What did Martin Luther do? Father of Protestants. led the emergence of this extremely important sect, Christianity, the Protestants, who do not accept the authority of the Pope. This is just one example of the application of scientific method. It was this application of scientific method that allowed us to understand our anatomy and physiology, everything that happens in our body, to understand body processes, to recognize that all diseases have a physiological, biochemical, or genetic and often a combination of these bases. And we began to identify precisely now in medical terms as what the diseases. So today we have a body problem to understand why. We have to really understand the causes. So we can say that to prevent this from happening, you should do X, Y, and Z. My wife would be earlier this month that some problem. She has some problem. We hired a constellation. We had a colonoscopy done. In clear as to why it's we know how to take care of it. And she's taking care of this problem. I think this is the scientific evolution of the scientific method, and it has allowed us to have these tremendous progress in medicine and related sciences, which have benefited us in innumerable ways. It's not only increasing our lifespan, but making our life more comfortable. The fact that people who have physical disabilities today can use prosthetics. The fact that those who are blind can get eyesight by organ transplant. Those whose kidneys and livers don't function can have liver transplant. And so on and so on. The list of things. But what I do want to focus your attention on is that this all has not been a kind of a hidden piece or a half-cent ecology. It's mainly very systematic and related to the evolution and development and evolution of what we today call the scientific method. We must recognize at this point the attributes of knowledge aid to the application of this method, which we call, unfortunately, we call it the method of science. It should really be called the method of body knowledge. I really object to it being called the method of science. That's what it is happening historically. The knowledge that we acquire through this method is never ever final. All so-called truths in science are tentative and are a result of the senses arrived at amongst people who understand this method who are practiced. So when I say that water consists of two parts of hydrogen, one oxygen, I think everybody knows it. Water consists of two parts of hydrogen, one part of oxygen. All that we mean is all scientists in the world, or trade scientists, accept this. There is enormous evidence in favor of it. There is no evidence against it. And every prediction made on the basis of this can be tested and found to be correct. That's why we say this, that water has two parts of hydrogen, one oxygen. We call it the truth. Truth. Until something is true. Chances of disproving it right is less and small. Because there is less of time in science. And in the truth, the longer period for which the truth stands, the longer the experiment, number of experiments that is supported, the longer the failures of disproving it, the greater, the lesser are the chances that ever be proven to be true. That's what we call the best experiment in science. But the fact that all truths in science are tentative and are truths by senses. The fact is, science often progresses by disproving. In fact, a good scientist designs an experiment that disproves hypothesis, not an experiment that proves hypothesis. That's the first thing we learn. That if we have a hypothesis, we either design an experiment that disproves it.
we can't think of any experiment to disprove it. If you haven't done it, it's not disproven. Then we say it's pretty much enough. As I said, science often promises by disproving. To know at least two of the prizes that were awarded in science to people whose discoveries were proven to be wrong. One was to a man called Manthan. He discovered the wrong structure of folic acid, which is related to cholesterol, down the acupuncture of the head. 6 months later, his technician discovered that he was wrong. But if he had not made the wrong discovery, the right one had not made it. So we can't rest the price. And the second incident is that the price of two of my very close friends, Sigurd Shiva and Martin Walker, who were given the Nobel Prize for discovering and science and making nucleic acids. I'm sure all of you have heard of DNA nucleic acid inside our cells, inside the body. It turned out that both the enzymes of which these people, the discovery of which these people were given the Nobel Prize, turned out not to be the enzymes that make nucleic acid. But if they had not made this discovery, the right discovery. Science progresses by disproving. And the beauty of the scientific method is that built in it is a method of correcting itself. Science keeps on correcting itself. And the scientist is never ashamed to say, oh, I was wrong. Or saying that I don't know. And another interesting thing about answers that we find through the application of scientific method is that truths with quotes is that they are verified. Anyone can verify it. They don't have a supernatural answer. Anyone can verify it. In fact, first thing that we used to tell the CCNP and PhD students to join was please do not accept anything until questioned. We could be wrong. I used it when I chaired final selection and people were selecting patients to CCB. They went through tremendous amount of screenings of from 3,000 down to 30. We generally say 5 or 6 out of it. And the last get together got into it. David made it sure that somebody makes a wrong statement. And we only picked up those students who challenge that statement. We were what to read leaders, not followers. Leaders must question. And I can tell you it is a fantastic experience. Some of these people are extremely famous. They go to two of them and they will win a Nobel Prize. Went through this procedure. And very interesting that I remember one case of a student from Bhargava University. First generation learner in his entire village. And when I made a statement, which is wrong, this man was so clever, the director of CCA, he does not know this. He got up from his chair and he said, you are wrong. He picked him up. He's the one who developed the Prashant Bhargava, the first advanced. And there were people who came from public schools, they were very polite, said, sir, I don't believe you're right. Different ways of saying it. The point is that they knew had this obligation to challenge something if they think it's not right. That's the integral part of science. Science promises because people exercise their right to question. But science also prescribes under what circumstances they question. Question for question's sake. You must try to find a flaw in the idea argument, make a new observation which explains a lot more what was explained by the earlier explanation. And so on. These are conditions for question. And another very important attribute of science allows to make estimate predictions. It's one of the finest attributes of science. And that's what keeps us glued to the science. And if we had formed an interesting theory, then we make predictions. And then we design experiments to test these predictions. Example, Pluto and Pluto was predicted. It was predicted because there was a discrepancy between the observed path
side, the telescope was a telescope, I don't know where, shot back perhaps, pointed towards that space inside, and there was a stand. We have a photograph of this taken on that field. Those of you who remember your high school chemistry remember Bentley's periodic table, which he arranged elements in some kind of order. So that elements in the same group have similar properties like sodium, lithium, sodium, potassium, or chlorine, iron, different groups. And he found there were gaps in the state. So he think that there must exist elements that were not known in nature. There must exist to fill in these gaps. He predicted the existence of Gallium standing. And for Gallium, he predicted that when Gallium is found, it will be found where the leaf of the planet. Gallium becomes a very important instrument. Today, it was found setting, or it was found to be 30 degrees, which is the temperature of the planet. The history of science is replete with millions of examples where the studies have been made was incomplete. And that's one of the great things about science allows us to make test operations. And that's what we do, for example, when we do clinical trials that we have done all over, and we predict that if this drug is to have this effect, this person should be cured of this particular disease. And that's why we go to phase 1, phase 2, phase 3, phase 4 trials before a drug comes to the market. A drug in modern medicine takes about 15 years to come to the market. And in the present system, it costs about $1 billion in testing before it comes to the market. The fact is that there is a method in all of this. And the method has been validated over centuries, billions of ways. It is the result of this ability of this method to validate that has given this generation, mankind today, everything that you have, radio, television, or X-rays, or CT scan, or MRI, or even a simple shaped razor, or a potato peeler, or a mixer, whatever, telephones, pickups. I think this predictive art science. It is in this context that I have just mentioned of how modern medicine has helped us, that it is not an accident, and it is a consequence of the application of a specific method which has worked, which the proof is there in everything that you do every day. And then we must keep that in mind when we assess anything else. Now, having said this, let's look at one or two alternative systems of medicine. Let's look at Ayurveda. And when I say Ayurveda, we true of 4 other indigenous systems of medicine. Siddha, Unani, Tibetan, it's all documented like Ayurveda, and undocumented tribal systems of medicine. Now it's very interesting that if you go back to what I said, that when I must have had ways of doing some diseases, I'm not wrong. I'm sure some of you must have asked yourself that kind of question, what would happen in these ways? It turns out that all primitive societies, all tribal societies, all civilizations have it one thing. They all had plant-based cures. Everyone. Whether it's the Incas, or the Mayans, or the Babylonians, or the Sumerians, or the Chinese, and of course, all parts of the Indonesians, Thailand, Vietnam, all these countries, and they have a repertoire of these plant-based cures. Every country has that plant-based formulations. Some diseases. Let's take his partner. Now, in the traditional use of plants, what do we see this? The outstanding example that we collect as what is this? I've forgotten this silver name. Anybody know what the it's called Puya by one of the languages. It's plant that grows everywhere. And it has been established that it's a very active way of hepatitis B. Disorders. Traditionally, it has been used to take care of liver problems. The interesting thing is that in many of these cases, the same plant has been used independently in food reactive batches. And when the service is now standing, it has been used by Chinese, it has been used by Indonesians, it has been used by Pakistan, Thailand, Vietnam, it has been used in Africa. Every part, every traditional system of medicine uses the same kind of things. Now we have in our country 40,000 plant-based formulations. 40,000. These 5 systems of medicine, each formulation being distinct. They use 8,000 documented parts. And this documentation is available to my friend National Center in Bangalore. We write documentation. And attempts are being made to document these formulations as well. 40,000 formulations. What do we have? Traditional plant-based medicine. Now, in traditional medicine, there was no diagnosis. We know diagnosis is based on taking blood out of you, taking your urine samples, or doing the internal examination by CT scan, or bronchoscopy, or colonoscopy, or whatever, or MRI. None of these techniques are done, and there were no cases. So, in traditional medicine, you went from symptom. Symptom was disease. That's what the doctors say. But there was no time. Today we say these are symptoms. Then we say you suffer from certain symptoms. So you have eyesight alone. Earlier we say the disease is jaundice. Jaundice is not a disease. It's a symptom. It can be obstruction. Obstructive disorder. It can be hepatitis B. Other liver functions. Each one of them needs to be good. So, this was a limitation that the systems have. But, the fact is that several of these formulations have been tried using modern systems, using modern system of standardization and validation have shown that number is very small. In fact, it is a pity that there is only one of these 40,000 populations which raise the part of water medicine. Homeopathy is a mixture which identifies standards using water medicine. And then they show that each batch will have satisfies using one system of identification. You know what that population is? I bet all of you probably have heard of it. But you can't recall it. Anyone recall? Best known Indian traditional plant-based population which is now used, which is a part of modern medicine. Live 52.
standardized. I say standardized. Ultimately, you can't base domination class. It was called as a certain kind. Not always one, you can create each other. But it's always a certain kind of thing. I'm all that the composition of the mind will depend on the climate. So I don't you will need that your vegetables will taste the same in all different places. Same slope, these plant that I used to make, these plant these guys. Therefore, you must standardize. Therefore, this really is important because you can fractionate everything. You have pharmacy, photography, it gives us a profile of the substitutes. We can find which of these pieces it makes already explained to test the various conditions. We have test systems available today. And if something works with these test systems, it's likely to work on human as well. There's no power in this. That is how we achieve this. That's why it's now prescription. We don't recognize it. What we call over-the-counter drugs, which anybody can buy, anybody can prescribe. Anybody can prescribe homeopathic drug, anybody can prescribe Ayurvedic drug. We were fighting that because there needs to be level standardization. But you can't prescribe homeopathic drug. You cannot prescribe medicine. You must be able to assess it. So, this now is a prescription drug in Europe, and I think it's going to be a prescription drug very soon in the United States of America. So, what we are absolutely clear is that out of these 40,000 plant-based drug formulations, using about maybe 10,000 plants, 8,000 which are known, at least 4,000 should work. Now, if 4,000 can should work, let me tell you, India controls the world health. Every year, only, on an average of the last 10 years, 18 new drugs are put out. Exo, 18 drugs on an average, sometimes 14, sometimes 20, take an average of the last 5 years. And this number is increasing here. It costs, on an average, $1 billion to the drug market. Generally 1.5. To put an Ayurvedic drug market using all the same procedures, standardization, phase 1, phase 2, phase 3, phase 4 trials. If you do it in 3 to 4 years, the cost will be $5 million. When contrasted to 1,500 million. We have a whole detailed problem. But we must recognize that not every one of these drugs are good. They must be tested scientifically using the method that is worked over centuries that has given us everything that we have. We must use the method to test. And that's, I think, is going to happen. Today, last number of women, in fact, almost everyone is interested in looking at these plant-based combinations. We will realize that we no longer need to look at a new molecule or isolate an empty molecule from these. As we did, for example, we got recipe from now we have got interesting from this flower. And that was an interesting everywhere. So that art which we got next song from the market view. These are people. But in most cases, you don't need to have. But the point that I want to emphasize is that it is the use of the scientific method which is going to give us the solution. That if India can market next 10 years, 100 years, you already have a proportion of 100. And this is better than the possibility to do that. In fact, we can market it faster in the next years. And the turnover will be $100,000 at today's prices. All this has been using the scientific method. Validation, standardization, validation, manufacture is standard, what we call good manufacturing practice. So you use a good laboratory practice, good clinical practice, clinically testing with rather good manufacturing practice. And the criteria of these have been extremely helpful. Now look at against this background. Let's look at some other aspects of mind. The use of panels. Because now this afternoon there are somebody from Bangalore who came to see me. We're looking at these Indian knowledge systems. We have now known this. Metals that are used now in the market is a disaster. We don't know how many people are killed in this country because of the use of mercury by our physicians. It's unfortunate that we can't, because for prescribing Ayurvedic drug, we don't need a license. Anyone can prescribe them over the counter. Anyone can write, you can write a prescription for Ayurvedic drug. Right? And say, to the shop, please give me this. See, anything you can buy without prescription. Because in our country, you can buy allopathic drug without prescription. We have only country, you cannot even buy these drugs in Thailand. You need a prescription to buy medicine or amoxicillin or any Ayurvedic, any modern drug. But in India, by law, you do not require any prescription to buy Ayurvedic drug because they are over-the-counter drugs, they are not prescription drugs. This is led to large which never get to go. In fact, these Ayurvedic physicians who prescribe these bhasmas and so on, in any other culture, would be liable for homicide. But there is a way toxic. You know that in Canada we have this. Many of them take seriously by using these Italian preparation, Ayurvedic Italian preparation. And Canada brought very bad people. The point I'm making is that we have traditions or any other system of medicine which is not evolved by following the scientific method. We must put it to scrutiny of something on this method. And when we put it to scrutiny on this method, we find that probably many plant-based formulations would come out successful. Some of them will not. We already know some of them don't. Some of them do. But as far as metals are concerned, they don't. The point I'm trying to drive home is that any what we call alternative system of medicine, for it to be accepted, we must go through this process of scrutiny using the scientific method. That's extremely important. Now, coming to homeopathy. Let me sum it up in one sentence. And if ever there has been any system of medicine anywhere in the world which has an eyebrow scientific basis, that's homeopathy. And every step is full of absurdity from the concept to the claims. Now, as far as the concept is concerned, let me tell you about this absurdity. There is a number called Avogadro's number. It says that we have so many molecules and one their molecular weight. Their molecular weight of water is 18, 16 is the atomic weight of hydrogen, of oxygen, 1 is the atomic weight of hydrogen, we have 2 parts of hydrogen, 1 of oxygen, so 16 plus 2, 18. The 18 grams of water will have 6.23 multiplied by 10 to the power 23 atoms. For chlorine it will be 35.5 grams. And so for salt it will be 57. We'll have that and power 23. Now you can very quickly calculate that if I take 1 part, try to put it in 10 parts of water, and I take 1 part and keep on diluting it 30 times, there would be a single molecule of the carbon. is whatever you use to dilate. You will say tablet and you use fructose to dilate. So all that's fructose. Now, how many of you realize that if I take the labels away from these Ayurvedic drugs which are 30x or 40, 60x or whatever, there is no way, no Ayurvedic doctor can tell me what's wrong. They never thought about it. Just simply take the label away. Now, unlike any modern drug, take the label away doesn't matter. You just analyze it really well. We do it every day. Every one of them is only factors and nothing else. No way that you will identify it. Fructose is a relative of glucose. It's a kind of sugar which is used to diet. I enjoyed using these. My great-uncle was a professor of physics at Harvard. He used to keep these at home. I used to steal those pills because I found them wonderfully sweet. I had gobbled up the whole bottle. It was not that I enjoyed it. You know, fructose has a very interesting taste. So, now, even given this, even given the scientific absurdity of the whole idea, I am willing to accept there may be something in it if it works. If homeopathy works, all of science will be thrown out of the window, which will be action. But this excellent is going to be everything that you have to say about it. And they are abstract, they work. You tell them words, you say what words. We have to throw it out. Don't kill it out. The fact is that all controlled trials there's not one single trial where homeopathic medicine actually work more than a placebo. See, 50% out of every 100 people who go to a physician, 50% will get cured by themselves. All that a physician does is to prevent you from suffering during that process of cure. Suffering from cold. You get cured. Physician doesn't cure you, all that he does is gives you Prozac, if you have some temperature, you feel better. It's not very good. He may give you an antibiotic to prevent a secondary infection, which in case is very likely. You will get cured if you don't go. A good doctor today, let me tell you, we have today, because medicine has become commercialized, we have lost the tradition of having a family doctor or a general physician. Now, no matter how many of you go when you are sick, you go to a general physician. You go to a specialist. You say, sir, that's one of the main one. Yes. I said only until the world today which has a decent system of medicine is Britain. There, if you are sick, you go to a general physician. Your family physician. He knows your family, knows your history. And if he recommends that you go to a specialist, you go to a specialist, you don't pay. Even as hard as surgery. The waiting list is not a problem, but the fact is that this is you know, Hyderabad, it will be difficult to count 10 general physicians and was medical capital. I would try and pose to my medical friends that please start an MD in family medicine so that you produce these family physicians, general physicians. We don't have it, which we had, correct? And that is why many of us open our own CCMB and ICD, our own dispensary. And we recruit people who will be good general physicians. And they know what their limits are. And a general physician can take care of 95% of the cases. You don't have to go to a specialist. In fact, going to a specialist can be disastrous. Let me tell you why. Where is the point where a person went to several specialists? All of them gave to him a course of antibiotics, so he was having 7 courses of 7 antibiotics. He went back to the hospital with antibiotic toxicity. Because the subject, the specialist looks at his system. He doesn't look at what's wrong with the rest of you. The general physician looks at all of you. So if you go to a general physician, and a good general physician, in 50% of the cases, shall not give you any medicine. He said, let's wait for a few days. Or give you aspirin. In case you have proceed if you have headache or something. So let's wait. And 95% of the cases, he's right, you will cure yourself. What is the message? The message is that any one of you can set yourself up as a doctor, prescribe what you wish. If there are that's 50% people will get cured. You can try it if you wish. You're 50%. Of course, you have to be nice. You know, you have to be nice to the patient. If that happens. If a patient doesn't want to get cured, then that delay is getting cured. So 50% people. So all homeopaths, all witch doctors, we have 50% success. People who have faith. You give a placebo, they can also give 50% faith. You go to a medical college, 5 years of university, cure the rest. Let me tell you that even there, over 95% of people are doing outlook of 12th June. Sure, I mentioned this, 95% of people suffer from less than 0.1% of diseases. Is that incredible? There are 5,000 known inherited disorders. Frequency in many cases 1 in 20 million. But that's a disease. Common disease is a very few. Anybody can take care of it. Ice is very good. So anyway, point I mean is that homeopath or a witch doctor or a chiropractic or whatever, or anyone of you will cure 50%. The question is, what is the cure over around it? And if all these studies have been done in the Lancet, which is one of the world's best known medical periodicals, I decided, and earlier this year, had an article which analyzed all the articles on homeopathy published in the diagnosis. It came to the conclusion that is the death knell of homeopathy, and it has absolutely no validity whatsoever. Coming from Lancet. Lancet is one of the most responsible medical journals where most of the large portion of the studies in medicine and homeopathy. So neither has any scientific basis whatsoever. Scientifically, you can't think of anything more absurd, nor has it ever been shown to actually work by a prostate cancer. I remember that once I was in Bombay, there was a new channel that ZTV was going to start, which never came about. They paid us extremely well. So I went to Bombay to appear in this program, and it was on homeopathy. And this lady, the best of Bombay was there. And she said that part of the problem is that we treat each patient differently, and therefore we cannot have these controlled experiments that you talked about. We take 1,000 patients and give 500 no medicine and 500 we give a medicine. And that's what we do when we talk of validating a modern medicine. We do double blind trials. We take a number of people. We have exclusion criteria, very strict inclusion, very strict exclusion criteria. Who we include, we shall not include. And then we give half of them the medicine and half of them the placebo. And the doctor does not know who is receiving what. It's got double blind. Nobody knows. Different people have different keys. Only when the results are there, the keys are open. You know whether it's effective. Not double blind. So every single medicine you see in the market, modern system medicine, it's come to you through these double blind. So when I said, why don't you do this? The answer was that because each patient is different. I said, look, how many drugs do you have? 100, 200, 500. How many drugs do you have? 1,000 drugs. Therefore, the palm patients do give the same drug. Can't get away from it. You don't have 6 billion drugs. So we bound to give the same drug to those people. So select those people. Select the 1,000 of them to whom we will give the same drug, 500 will give the drug, 500 will give the drug, and you see the effect. And whenever this has been done, not a single study so far. The drug group has been found to be any better off than the placebo. So neither do we have scientific credibility, scientific accept, nor is it a proven. Where is the question of acceptance? And there are amazing statements. As I was leaving my office, my colleague Chandra, some of you gave me some material. Very interesting. For example, one point has made is when you dilute something 300 times, one part to 10, one part to 10, one part to 10. So it's 300 times that formation. The question of your having any drug molecule there doesn't arise. Not only that, you have contaminants. Everything in this world has contaminants. Nothing is absolutely pure. Not at all. Some is a board as bacteria. We have all those contaminants. What is it that's you're looking for damage? When you are not a single molecule of your drugs, then they say that in some magical way you energize the calorie. Now, what is that magical way to really understand energy? Look, if you didn't understand energy, you would be able to produce nuclear energy or thermal energy or hydroelectric energy. Convert one form of energy to other, we convert chemical energy to mechanical energy when I'm doing it. And we know exactly how to do it. We can make it do it, we can take muscles, make it do it in a testing. So what is that mysterious energy that you produce? And how does energy feel? There must be some reasonable explanation somewhere which has some modicum of tenability. There are answers to these questions. In fact, very often people will try to tell you, but homeopathy is practiced all. Yes. As much as witchcraft. Witchcraft is practiced. Please go to Piccadilly Circus in London. And the increase in the number of books of witchcraft and black magic that you see along with the semi-pornographic books has increased exponentially. Witchcraft is also practiced. And so what about arguments? What about numerology? And so on. There are books that practice it. We generally cite Ayurveda. Do you know that there is a single homeopathic, what is called school in the United States? The last one was closed in 1920. Not a single homeopathic school in the United States. Alright. Then you will agree that those people are not less healthy than our with their problems. There are problems that they can't overeat. The greatest problem of that guy is obesity. The country has no malaria, it has no smallpox, no plague, no cholera. It did have tuberculosis and recently the cases following the rises of AIDS. They don't have homeopathics. So in fact, there are basic stories regarding somebody says that the chances of your having molecules and constituents of beer in a glass, if you wash it 100 times, are far more than having a drug in a homeopathic drug.
Sounds good.
And I said that the most important thing is, if you take the labels away, then I would like you, in all humility, please go to a homeopathic. I can't go to them, they'll kill me. They try to kill me. But I would like you to go and say, Doctor, I have unfortunately all these labels are lost. Can you tell me a place where I can find out which is what? I would like anyone to be able to tell me. You'll agree same and there's no way of knowing what is what, it cannot be a God. They will tell you. I was telling you a very interesting story that comes to my mind. All of you know about the fact that there are these preservatives that all our animal husbandry industry is because today you can freeze the wild semen from prize bulls. You can freeze it for 10 years or 100 years, and then we can take it to various places and separate cars. That's how it was done in this country. The artificial insemination is everywhere. And there are ways of freezing. Now this story of how this was discovered is very interesting. In the 1940s, at the National Institute of Medical Research in London, where I had the privilege of working in 1956 and 57, the institute which has produced about 7 or 8 Nobel Prizes, and my friends, and we had that time. 1940s, a man called Alan Parks, a very moody, very difficult man. I knew him, I brought him to Alan Parks. Sir Alan Parks was one of the most famous reflective artists of the time, fellow rock star. Here in Australia, on this body, and they wanted to discover a diluent which they can add to bovine semen and which would allow this sperm cells to be frozen. See, if you freeze any cell without diluent, the cell will rupture because the water will become ice expands, and the cell will rupture. So you need a proper diluent to prevent the cells from rupture, which is able to replace the water. Then when you remove this, thaw it up, get it to diluent, it is reconstituted. Because they realize this will transform and as it is done. So one day in the laboratory, into that room, into that famous fridge, this institute, Chris Borgay took a bottle out. And it was labeled a mixture of amino acids. And lo and behold, when he added it to freshly collected bovine semen, and he put it in the freezer, and he took it out a week later, the sperm cells were alive. Fantastic discovery. So, he thought he had discovered it happened. So what he decided to do was to look at the composition of the water, and he made a fresh medium. Now he made a fresh medium, it didn't work. See, that's what science is all about. It didn't work. So he was intrigued. Then he took that solution from that bottle. It worked again. Same composition. So he said two things. That's how scientific method works. A, he said, either this thing has aged and therefore things are broken down, or it is wrongly labeled. He said, let me analyze it. He analyzed it. You know what it turned out to be? 50% glycerine. You know, everybody knows glycerine. 50% glycerine, 50% water. That was the first diluent that was used around the world. 50% glycerine. The fact that you can analyze it and say that's 50% glycerine. Can you do that for homeopathic drug? Tell me, why should I believe in homeopathy? It's unscientific, absurd. There's no evidence of its working in properly controlled trials. Yes, if you go to a homeopathic surgeon for headache and you think you'll be cured by the drug, well, good for you. I have no problem. You must ask yourself the question, is it the drug that cured? I got cured by myself. So in this, what we call anecdotal evidence doesn't work in science. In science, it must have a raw people. It's not anecdotal. To be this time. Anecdotal evidence is, I tell you, let me tell you people, there are some people who believe it. If I tell you bet you I find people depends on how I say it. Maharishi Mahesh once persuaded me to come to Institute of Medical Sciences. I was there for a few days. Mahesh said, it's all on record, that he has the powers to prevent the sun from rising tomorrow. So we said, well, why don't you do it? Oh, but it would be good for mankind. If you believe in him, you will believe that he has powers. But to me, if a person believes that, I think only God can save. God can save. Believe it. So I think that's the story about homeopathy. Now I must tell you that I have nothing against the practice of homeopathy, for that matter, and even witchcraft. I have everything against government supporting it. I have nothing against this family giving fish medicine. I have everything against government spending 25 crores. That money could be much better used. Fish medicine is another example. Now just look at it. We filed a case last year. So they have to say, remember that there is no evidence that medicine work and displayed everywhere. Then they said it is not a medicine, it's a prasad. So this year there was no fish medicine given, it was prasada medicine. Is that honest? There is a law in the country that you cannot administer anything to anyone unless you declare knowledge. You cannot give it. Every medicine has to have a label stating what it is. They were contravening them. They should have a table. Why do they try to explain all that? I don't understand. So I think what civil society is. We need to ask these questions. I said, I'm not against it. You can go to homeopathy. You get cured, good for you. The only thing you must realize is that a large number of people in this country could have got cured, have died because they went to these people like homeopaths. And they are done. You know, we have a dispensary in CCP, which caters to CCP, ICT staff, a total of about 6,000 people in family members. We have innumerable cases where a person is persuaded by friends to homeopath or to an Ayurvedic physician who's given them these methods and so on and so forth, and some other systems, witchcraft or whatever. These Oja doctors, and they come back determined to stay back to the dispensary. There is nothing to do about it. Their life could have been saved if they simply had stayed on. Followed the advice of competent doctor trained modern medicine. So what worries me is that valuable lives are lost because of this. So I think we need more and more education amongst people, parents, and recognition that the scientific method has worked. We have innumerable proofs of it. The very thing that you see, let me say that the fact that you press a button, the light comes. This is not a miracle. You say how this happens. You can't just try that science which is giving you everything to your hand and say, no, here we will not accept that. The same science that tells you that the history of man is recorded. Few hundred years from now, I was made a list of how our those who come after us, the nations to come 5 years from now, what will they laugh at? Smoking. How could our ancestors engage in habit of smoking? How could they believe in a ration system such as that? So I think I've taken more time than I intended to. excitement of reason. Reason is the most exciting thing. And that's what sustains us. Life harmony is the same reason. You can't have different standards to evaluate electricity. And thank you very much.
Thank you very much, Dr. Bhargava. Excitement of reason, golden words. I'm sure this has touched several of you one way or the other, because we are not given to extreme approaches. Dr. Bhargava is here to answer your questions. Yes, please. I go right there.
Thank you, Dr. Bhargava. I was very impressed with your credentials, who you are as a person, and of course your talk also. When I spoke to her, she says, "Oh my God, don't you dare go there." And I said, "Why? It's very interesting. Come, let's go." And she says, "No, don't even dare go there. You know, this Ayurveda stuff, my friend has been taking it for the past few years or whatever, and only this morning she passed away, diagnosed with an overdose of what you call Ayurvedic medicine." So it was very disturbing actually. And yes, I have been warned of these kind of mental inclusions in these Ayurvedic medicines also, and have stayed away from them. However, my wife who's sitting here is an avid fan of homeopathy, and we've got 6,000 bottles in our room and she's found yeah. So now I know allopathy doesn't work, I know homeopathy doesn't work. Allopathy kills, Ayurvedic kills, homeopathy doesn't work. And allopathy has only a 50-50 chance. So I'm really confused now. And yet we have made progress having used allopathy. But again, another point comes to mind. When I was a child, I was diagnosed as having asthma. And I was a very chronic patient of asthma. And it's ironic that you mentioned this so-called fish medicine. And my friend took me when I was 15 years old and chose one of the biggest fish in there that felt like I was swallowing a shark, but it helped me. Only that it backfired the past couple of years and I've started to have attacks of asthma again. So all of this is really confusing me, doctor, and I really am very impressed with what you have to say about the 40,000 so-called cures or drugs that are available through the herbal means. Now, what are the chances of those coming into the market, and what kind of efficacy do they have for not only Indians but humankind? So I'd like some clarity on this, please.
I'm sorry if I gave you the impression that there were many chances that you said no. What I said was 50% of people who go to a doctor don't need to go to a doctor. In the academic systems today, we are very fortunate. A vast variety of problems can be solved one person. Today, there is no reason for somebody to die of tuberculosis or typhoid, of most bacterial infections. Not they have problems. For example, on account of the organoleptic use of antibiotics, overuse of antibiotics, we have evolution of antibiotic resistant strains, methylene resistant staph aureus MI16, which is a hell of a nuisance. And if you have that in all, let's say, for those who don't know this vancomycin, then it's a problem. But the fact is, otherwise your lifespan would have increased to 80 years.
maybe at 62 or 63 years or 53 years, just 25 years ago. So there is a huge system to buy, so there is no question about it. In fact, today we can make shortlist those diseases where we have a problem. Viral diseases, we have a problem. As we have to, like, we are not by no means as efficient as we have for common throat infections or for tuberculosis. We don't have to go for AIDS. We have problem with disorders and nervous systems, psychosomatic, psychological, and neuropsychological disorders. We don't have to go to many of them, but people are working on them. We are pushing the frontiers using the science. We don't have cures for all kinds of cancers, but then also we are pushing the frontiers. Today it is possible to take care of much larger variety of cancers than it was possible 20 years ago. I myself was involved in discovering a well-known anti-cancer drug, 5-HT, which I think the sales today are more than $20 billion. We discovered it in 1958 in the United States. Yeah. So, allopathy works. In many cases, 100% like I said, no reason for today to die. When my brother and I suffered from typhoid, my Upati suffered from typhoid, he died, he survived. The survival rate was 1 in 3. We were 1 in 3. We survived, he was 2 out of 3. He suffered. Today, nobody needs to die. Don't be attracted to this. Now, in your case of asthma, you see, we have to review that many diseases, including asthma, are also controlled by the environment. People who are severely asthmatic in Bangalore are not asthmatic in Bangalore. So change of environment, because there is a large, the pollen count in Bangalore is high. Yeah. Similarly, there are natural emissions. The emissions even of chemicals, cases not where doctors have been at, but the body has reacted in ways that we don't fully understand. And then do a test. Then individual condition, which are learning, the fact that all medicine will be individual is a very advanced in medicine by through modern science, not through these witchcraft. All will be able to do much better by looking at you as an individual, by looking at your procedures, knowing your susceptibility status, your response to drugs. Different people respond to drugs differently. That also is extremely important. In some cases, the drug given at 12 o'clock at night and 12 o'clock at midday is far more efficacious. In other cases, it's 6 o'clock in the morning, 6 o'clock in the evening, because the diet and the circadian rhythm is different. We are beginning to understand this. Now, coming to these 40,000 formulations, I think the challenge there is to find out which ones work, which ones do. First, you must standardize them. You must convert them into a saleable material. What I mean is the following, that traditionally, the Ayurvedic physician harvested the plant at a certain time of the year. All that is prescribed in Charaka, Samhita, Sushruta, time is given, and then you use the material fresh. Now, if you want to market it, you can't do it this way. Then you use it for 10 people, in the range of 100 people. You want, 100 million people to use it. Therefore, you must make it market. Now, the latest at rest, traditionally, you are having to give you big bodies, the size of this. When you use the pack, and you have 30 of them, and you move. This is bad. If you not market it, you space it up price. Transport charges, and compliance. The compliance of 2 tablets a day is much greater than the compliance of 30 tablets. Totally, that's why people spend on slow release drugs. You take one drug, one capsule that takes 14 hours. And the question is stimulated. That's why we lost our belief. Indian scientists did everything on it. But what they did do was to recognize that everything which is the active constituent of heat is unstable. And Americans worked out and were stabilized. So your new products can be now kept for a long time in the shelf. Shelf life. Lately that the drug, what is the shelf life is 5 years, is it's more likely to sell than the drug itself lives 24 hours. So these are the issues that we need to worry about. And as I said, my very conservative estimate, 4,000 of these must be found to be as good as any allopathic drug. And they should become allopathic drugs, because all that you need to do is to let them go through this process of validation, standardization, validation, and manufacture by the manufacturing practice. But today, you know, if you really want to see what the manufacturing practice is, please go to Chantabali and see how the manufacturing practice works. What are the standards of cleanliness that they look at? When you say 1 in 100,000, which means that you know well the chances of finding one particle of anything in 100 cubic meters are 100,000. That's the standard of cleanliness. Which are very effective in these standards of cleanliness. So the amount of contaminants in the homeopathic drugs, believe me, the amount of contaminants you have are far more than the drug that is supposed to be good. Which anyway the homeopathic physician cannot do. I hope you someday you will experiment, please, if you call me, take homeopathic, take these bottles, change the labels. And I can also tell you, change the labels, let them consume it, it will not be one, they will still get cured if you want to.
Doctor, one more question, if you don't mind. When people talk about the power of the mind, like, you know, if one was to meditate or have positive thinking, and you also hear about cases where, you know, just the personality of the doctor cures the patient more than the medicine, etc. So does the body create various chemicals to fight the so-called disease just by the power of mind? Is that also some kind of a theory that you have looked into and have any statistics on?
Okay.
The body does create mechanisms which are not dependent on the power of the mind to fight. The whole immune system is that immune system that keeps us alive. We're constantly being infected, and I'm very grateful because I must tell you that it is for this reason that drinking bottled water to me is a disaster. There was no bottled water in the United States before the 1970s. There was no bottled water in Britain before the 1970s. It was the French advertising because the bottled water industry was in the public sector in France. 3 kinds of water, Evian, Perrier, and Vichy. And they started high pressure advertising. Now, the problem with these people is that their bottled water is real water, real spring water. In our country, bottled water is not spring water. There are 3 kinds of bottled water here. Dirty water, like your sewage water, is much worse than your tap water. So we got a lot of their bottled water here. Second is the normal water that you take out of the tap and just put in the bottle. All this Coke and Pepsi is exactly that one. Nothing more. You can never imagine. Just that. You pay 10 rupees for the bottle, the water comes out of your tap and running through a filter, costs you only a few pesos. You pay 10 rupees for it. And I can tell you that the real spring water, which is bottled water, is not very good for you. See, we in India are very fortunate. We have a large number of infectious agents. So we have been constantly exposed to these infectious agents in very low amounts. And our body generates the immune response. So we have antibodies against the virus tested with low antibodies against 150 infectious agents. So I never ever had a stomach problem. Of course, I don't do the folly of drinking cane sugar juice on a hot May afternoon after the machine has been used for 50 other people. That's a folly. But otherwise, I drink water. I always drink tap water. I have a problem in these so-called 5-star hotels where I spend 12 or 13 nights every month. A problem in the hotel because the other day I was in, where was it? It was in the Grand Maratha in Bombay. So I was checked in, somebody came to check me in my so-called one of these deluxe rooms. And so I said, where is the water? So he said, there's a bottle of water, 1 bottle of water.
fridge, there's the compliments of the hotel, and there are these bottled water which are in your minibar. And there was 2 bottles of India, 350 rupees. 1 liter bottles of India. So, sir, we have India. I looked at the price here. Please, I said, no. My dear, can you just give me ordinary water? I would like a can, that was ordinary water. So after a while, the bearer comes to me with 2 bottles, compliments of the hotel, a mineral water. I said, but I asked for ordinary water. So, 9 o'clock at night, you wouldn't believe it, we went to the gym. Probably Grand Raja. Gym calls me, sir, I believe you have problems with water. I said, doesn't your hotel provide ordinary water? Which is, I said, water which comes out of the tap, which you have filtered, these various filter systems, they got whatever. The 5-star hotel is required by law in the country to have that water. Yes, sir, we have that. But you are the first person ever to ask for it. I said, even if I will pay you 5 rupees for it, I will pay you for it. Please give me that water. I want my immunity to be maintained. See, this water is passes on the approach standard. It has a small number of bacteria, which is what has built this immunity. But when we go outside, we don't fall sick. When the pattern comes here, my God, first thing we get is a stomach upset. You know how lucky we are? The fact that I have traveled to all kinds of places, to forests in Africa, Indonesia, Thailand, Vietnam, I have never ever had a stomach problem. And the reason is that I have immunity. So the point there are these systems that we have. There is a power of the mind, which is, that's why we say that your mental condition does play a role in your life. But power of the mind cannot cure you of smallpox. Power of the mind cannot cure you of plague, of cholera, tuberculosis. Cannot get you back pain of leg. But it can be in a general development process. You know, when you are depressed, and when you are depressed, there are chemicals produced in your body that do act against the normal process of development. That's what probiotics. But probiotics still means we don't know how they actually happen. But if you want to cancer chemotherapy or major surgery, they simply aid your process of development. But they don't act as agents responsible for that, for getting rid of disease. So no power of the mind can get you rid of the disease, but it can help you cope with the disease and help you recover after you've gone through an appropriate treatment, medical or surgery. And that happens through intervention of chemicals. And if you are thinking positively, generate one cycle. When you're angry, why does your face get flushed? Because you get hysteria, which makes your face light. So there are these chemicals that pain, how are these endorphins discovered for which a Nobel Prize was given? It was discovered because people said, how does morphine act? So there must be receptors on the brain or when morphine is sitting and those receptors are blocked, then you don't feel pain. Then they discovered they said it must be natural chemicals which block these. Then that is how endorphins were discovered. As I said, the Nobel Prize was given. These are natural chemicals. That's why some people can tolerate pain much more than what others can. Now, I have seen my own eyes because I had a very bad cut when he had a vegetation. And they said, shall we put a look at it? They said, the doctor said, no, sir. The man said, no, you just do it. He said, why did you? I was watching this now. All this is open. And he didn't take an eye. His pain doctors was very good. Some people's pain doctors said, no, that's the part of these.
Dr. Bhargava, very, very interesting talk. And I don't think that I asked any questions, but it was just one of the observations that took off all the seeds of allopathic medicines and asked a doctor, he would know which medicine. If I tore off the sheets and I just gave a whole lot of things, amoxicillin, penicillin, and crocin, and I just gave it to a doctor, he would know. He would know which medicine is just as much as an allopath would know. Not and just as much as a homeopathic medicine. Why did I not try to hold a brief for a moment? But the thing is that the point that you're making is that, okay, an allopath doctor would perhaps take his tablets, go to a clinic and then try and see what it is the medicine is. So presumably a homeopath also, if you took off the labels from the bottle and showed it to the experts, he may be able to identify what it is.
This
That's a
very
observation.
What I'm trying to tell you is precisely this. That in the case of allopathic medicines, if you take away the label, you just send it to any laboratory, send it to CCP, ICT, Vita Labs, they'll tell you what it is. In the case of homeopaths, nobody in the world, no one in the world will be able to tell you what it is. Because it doesn't take anything, they're all fructose. 100% fructose.
Look, that's the point, yeah, that's the point that's well taken. But what I would like to try to leave is that, again I'm saying I'm not holding a brief for homeopathy, but perhaps what homeopathy brought, which is the point which you were also making, is that the responses of individuals to any drug becomes very different, given the fact that the situation is different.
Within a range.
Within a range.
Not totally.
But again, the point that I would like to make is, yes, you go to a general physician. A general physician, no doubt, would understand you better than going to a specialist. But perhaps what would mean a certain amount of an interaction, not so much that homeopathy will be, but what an allopath could learn from a homeopath is to understand that each individual is very different. It is like the guns that are made. For example, there was an example the other day on TV, I don't know which show it was, where you had physics. You knew if you fired a gun, then it would shoot someone. But it is only when they discovered what is the ambient temperature, that Koleshkov, the Russian Ukraine, you knew how exactly when you fire, what is going to happen. The important point is that whatever may be homeopathy, whatever its limitation, what would be very nice is if there are so many people practicing it, it would be very nice if allopathy would take up just this little bit of differences of individuals coming in, which the general physician perhaps could do or may not be able to. The problem that comes up with allopathy is this tendency for making everything standardized. They've got it commercialized, they've got it standardized, and no one has the patience to want to go through what each individual wants. Another point which is not related to homeopathy and allopathy, but a point, very interesting point that you made was with regard to the garment spending. And I know how you feel. Why is garment spending so much on, say, homeopathy hospitals or subsidizing
Fishnets.
the fish? Yeah. Garment spending has nothing to do with fashion. They only look at it from another viewpoint altogether. It's just that's the lobby which works, and that's where the government gets the money.
Well, you see, I think we should remember that it is in the modern system of medicine that individual differences which could be itemized first step. Individuals are different, their metabolic rate is different, BMR is different, calorie requirements are different, and on the same effect, we've now persuaded the non-medical engaging into an extremely interesting long-term exercise of determining the normal values for Indians. We accept the hemoglobin value of the West, we accept all the enzymatic values of the West, we accept the blood pressure values of the West, and everything else. And there are reasons to believe that those normal values may not be true for us. And even in India, where we have 40 male ethnic groups and 450 minor ethnic groups, there may be differences. So a committee has been formed, which I am chairing, which will engage into a 10-year exercise, very expensive exercise, cost of 700 crores, where we probably look at 2 to 3 million people, maybe as much as 7 to 8 million people, and look at their parameters to determine what is normal for Indians. But even then, normal will never reach. So, and then we know what is it that we have to look for, because those are the parameters on the basis of which you are diagnosed whether you have a disease or not. For example, there is a test called prostate-specific antigen. Now, that's a marker for prostate cancer. If your levels are more than X, 2.3 or whatever, then you are supposed to be a candidate for prostate cancer, because those with prostate cancer have levels more than this. Now, it turns out in India, people are 2.7. They're completely normal. Therefore, maybe have a cutoff point, not be 2.3, but it should be maybe closer to 3. So, the system allows you to do this in a systematic way. Homeopathic system does not allow you to do it in a systematic way. So, in fact, even as far as individual difference of mental, homeopaths are great people from the modern system. Because they find in what way we are doing. And it's a basic metabolic rate. Why is it that X can eat all the sweets that one wants and still not gain weight, but Y eats this rate of it and gains weight? Because of basic metabolic rates. So these differences are very well recognized. I think there's always something to learn from everyone from each other. But I don't think there's anything that one can learn from my homeopathy.
Doctor, it was very nice to listen to such a systematic talk, and I really appreciate the scientific view of all the 3 medicines what we have learned from you. Doctor, I have just an opinion to view. This is something which is a personal view. I find that the allopathic medicine is more of the scientific, that you said, the diagnostic way of process. And I find the alternative medicines are more of symptomatic, as you have rightly pointed out to us. And in the Indian culture, if you have seen, there is more of faith on symptomatic treatments. And that is where maybe the alternative medicines have picked up their strengths. And maybe on the allopathic side, the scientific methods, the diagnostic methods have not yet found that type of support. That is why the other medicines are still prevalent, as we explained about the US by the homeopathic has talked. I think they are more of a scientific society, or they are leading towards a diagnostic society or a systematic society. But the area is so popular in India and not so popular in some of the other countries.
And you see the reason why these not in India but in many parts of the world, the alternative systems of medicine are becoming popular. There are 2 reasons. One is the post-ignorance. We don't know their Bedros number, they will not know that there is no medicine there. They will not know that I can change the labels. Not only that, if I change the labels and I give you the other drug, you will still get purely if you trust with the drug. But that's act as a placebo if you are going to do it. They don't understand. The second is very unfortunate turn of events in the last century, especially in the last 55 to 60 years, that medicine has been commercialized. Today, there were no private hospitals 30 years ago anywhere in the world. And when there were private hospitals, like the Mayo Clinic, or we had the Shankar, these were really run by trust. Now, in Hyderabad, in fact, the best private hospital is the Ayurveda. It's run by trust. The doctor, I was a parent by us, on the board of trustees of the hospital. We determined the salary of Dr. J. Rao, who founded the institute. His aunt is going to pay. Oh, of course, pay. Sure, that he gets every compensated. But now, not anymore. So it is the commercialization of medicine It is the false advertisement. Now we are getting to discover that even as far as clinical trials are concerned, they are paid for by the company and some data is withheld and not published. Totally unscientific, not a part of scientific method. You can correct anything to that. You're doing an experiment, if you report the false results, it is not the fault of the method. It's the fault of the people who are doing it. You know, there's plagiarism in science, they're reporting false results. But so it has nothing to do with the efficacy or the qualities of an allopathic system. It is that it has been so badly commercialized. You know, we are very fortunate in this country. We have the cheapest drugs in the entire world. The drugs in the United States cost you on an average 100 times more. And please try to buy a tablet aspirin in the United States. How much it costs? Please try to buy a tablet of amoxicillin. See how much it costs. What it costs here. It is a 100-fold difference. Ciprofloxacin, 100-fold difference. Between 115-fold difference. And the whole TRIPS and WTO is because India produces the cheapest drugs. There would have been no WTO and no TRIPS if that was not. So they're trying to impose this on us and attack prices. So it's not the fault of the system, it's our fault that we have commercialized. Like education. Tell me that any country in the world where education given to increase commercialized, only India is the only country where this is. The National Knowledge Commission, I hope, will take a strong view.
My reasoning was because of this, the alternative medicine is now building up.
Yes, you
This is something
are
like that has to be highlighted to the scientific side.
In fact, we have said that. We have said that if you follow all the problems of the TRIPS, it's exactly what will happen, that the rational, unscientific systems of medicine, more and more people will go to them. Because it must become private.
We're leading people to a wrong side.
If you push people against the wall, what will you do? I mean, you have read Victor Hugo's La Travel. You push a man to the wall, he won't speak.
Could you throw some light on stevia leaves which has entered into India about 3 years ago, and which is worldwide scientifically proven, which is almost giving good results on all mouth diseases, stomach diseases, and blood diseases, including of your asthma and allergies. Could you throw some light on that?
You see, I am very careful when you make the statement worldwide proven. I hear this every day. I like to see where is it proven. Has it gone through clinical trials, phase 1, phase 2, phase 3, phase 4? Who has tried it? Are they certified people? Is a clinical protocol done? I know, but I'm not saying it's not valid. What I'm saying is that before we say that something is valid, we must have authenticated proof.
Yeah, even in Hyderabad, our National Institute of Nutrition, the Medical College, Canada Medical College, have tested it for diabetes, for dermatology,
I'm very well aware.
from nutrition point of view, and they are successful in reporting.
I am extremely well aware.
And second thing is, in our country, most of the people being the poverty, below the poverty line, do not afford for the higher, rather the allopathic type of medicine. But this one being a farm product available below the cost of sugar, it is giving good results. And this is proven around the world, and there are thousands of research papers are there on this and all that. But what is being told, it is because it is a cheap product. This is dominated in the lobby. You are the company to throw some light on this. Some people are already got benefited, and day by day, more investment is multiplied.
Look, we must distinguish between several parts of the question. I am not in a position to give an opinion whether it works or it doesn't work. We may work, we don't know. I would like to see, as I said, experiments done following the rigor of modern science. Of this. I don't care if there are 10,000 papers, 10,000 bad papers don't make one good paper. Forgive I say so, but 2009 don't make one of 18. From the point of view of that. So 1,000 bad papers don't make one good paper. So we don't know that. I'm not familiar with this. I think it needs to, the moment it turns out that it is valid, it will become a form part of our medicine. It will be prescribed, available. So far, it has been done. I'm aware of this. See, as I said, anecdotal evidence is not evidence in science. I know of large number of people who do bad experiments. I'd like to see how those experiments happen. You know, science is not, you know, what we call a child's play. Extremely stringent departments in science. Doing a good experiment is something that you learn. That's why we publish large number of papers. You can't even repeat what we said in the papers. We are amongst the top 7 publishing countries in the world. There are no scientific discoveries that stood the test of time. Very few. So I heard about it. It has a potential, but it needs to be tested according to the rigors of modern science. Validated as it should be, standardized. I'm not aware of anyone having done this. A lot of people try it. Somebody comes and takes that. That's it. I must first standardize the material. Have they done? Have you made a clinical protocol? You know what a clinical protocol means. You need to look at it. You come to my office, I'll show you, but I sit on ethics committees also. A clinical protocol is a stringent, extremely stringently prepared document. That's how the testing is done. That double-blind testing. You acquire clinical research already. So that there is no scope for certificate. We have none of these trials. I'm not saying it will not work. It may work, but now we have that practice. But it has an anti-material. In China, we have done it, shown that it works. This is the market. It's a tremendous potential with that. We did that for recipe. Try it, but in 52, as I mentioned, testing, standardized. The ideology I met Ravi, whatever his last name is, was the chairman of drug company. Very fine man. He knows what he's done. And he told me how to make that. High standard of good manufacturing practice.
The thing is, there is an urgent need to test such products and make it available to the people.
I mentioned to you there are 40,000 formulations. Out of 7,000 to 8,000 plants, we have listed 58 plants that need to be looked at. This is one of those 58. That's where we need evidence.
Hi, my name is Rob. I have a question regarding the cost of medicines. In your talk, you mentioned that the drug discovery process typically takes 12 years to come up with a new drug. And companies invest more than $1.5 billion for each drug. And I don't know if you are factoring all the failed target molecules in that cost. You know that out of 100 molecules, only one makes it.
Out of 1,000.
1,000. Okay.
1,001, I'm including it.
Okay. So, and the life of a patent, as I understand, is about 7 years.
No. Life patent now is 18 or 20 years.
But that includes the time that are already gone.
To the new WTO regime, we are partly from 1st of January 2005. I think we have increased the life of the patent. That was 18 or 20.
So my point is like, if you want companies to continuously invest in research and development, is it unfair to expect a return on their investment? I don't know what is the right return on investment.
Of course. Well, that's why we say that companies now shifting their R&D to India because if they shift their R&D to India, the cost will come down. And as I said, now using rational drug design, the cost has come down from $1.5 billion to about $0.6 or $0.7 billion, and time from 15 years to about 10 years. And what we are saying is that many other kinds of drugs like peptides and so on, if you now shift to those as the source or marine drugs, this cost will come down further. And if you take plant-based drugs, as I said, 5 years instead of 15 years and maybe 10 crores, it is $2 million instead of $5 million. So these are.
So my question is like the countries which are fighting for actually free drugs, shouldn't they be diverting, make it a public health service kind of thing, and fund the drugs and give it to the citizens free of cost? But you cannot expect a drug company to give the medicines free.
Of course we don't. Nobody expects it.
But that's what most of the...
No, they buy this. Nobody expects all the drug companies are making money. But in India, what we did was required to have an article 7.1 of trypsin. Our organic chemists are the best in the world, amongst the best in the world. So they devise new routes of synthesis. So devise new processes to make the same product. And that's why, therefore, and the cost became very cheap. I would say example as a tea.
So then what is the value for the intellectual property of the person who actually discovered that?
No, I don't agree. You see, we must realize that making a drug requires a lot of intelligence, creativity. But making a drug by a completely different route, which is cheaper, better, quicker, also requires intelligence. Therefore, our contribution of devising new routes of synthesis, which are cheaper, better, and quicker, is known as contribution. Why didn't Americans think of it? Therefore, that's why I say that we should not have agreed to the product patent clause in our third patent amendment bill, and we are still opposing it. So, you see, this is a battle of wits. I see no reason why we should. If I have discovered a new process, please remember, ammonia was extremely expensive. Till a man called Weber came, I don't know how many years ago, about 60, 70 or 80 years ago, in Germany, and found a way of fixing atmospheric nitrogen to make ammonia, called Haber's process. He got a Nobel Prize for it. All that he did was to find a new method of making ammonia. If we had the patent system at that time, we wouldn't have been able to make this. Because the product was not new, method was new. We still have Nobel Prize. Why should we accept that as much as a creative activity?
No, but the reason he went after trying to get a new process for ammonia was somebody discovered ammonia was useful.
Exactly. But his one, that today ammonia will not be there, Weber's process was not there. So you see, making the same thing that is known by a new process also involves a high level of creative activity. Therefore, why should we underrate our creative activity and overrate somebody who was given us new drug, is given us new drug, very good. But we have discovered a new way of making the same.
What is so obvious to you that the Western system, what the modern system of medicine, scientific work, why are you not able to convince others? Where are you failing? Because we don't believe that it's no Indian physics, American physics is the same. But when it comes to medicine, why are you not in a position to convince others that the modern system of medicine is scientific and others are not interested? Where are you failing? Where do you think is the failure?
Oh, but please understand that today all over the world, okay, there are far more people who believe in modern system of medicine, those who believe in.
Because there are a number of same people here who think of modern laws of physics to accept. But when it comes to medicine, each one of them can have an opinion on
as I gave the answer, as regard modern system of medicine is concerned, a vast proportion, vast majority of people around the world believe in it, otherwise the lifespan would have risen. Not visible to another alternative system. However, you're absolutely right. A number of, within quotes, sane people, educated people, believe in homeopathy. We have some here. But let's also remember, a large number of sane people believe in witchcraft. Large number of sane people believe in the medical powers of Sai Baba, or believe in fact that Mahesh Yogi can lift himself and levitate and move around in this room levitating. Large number of people believe it. It's very unfortunate that our whole system of education does not make people rational. So something is wrong with the whole pattern of education class 1 onwards. That's where the problem, that's what we are fighting.
Is there any problem with our argument? That's what I'm
With our?
The way we are tackling the problem is something wrong.
No, the way that we are educated. I think if our system of education was right, look, from my personal experience, allow me to be modest for a moment. I was involved in 2 great experiments. One was the method of science exhibition, 1977, which the Janata government tried to destroy, but it was seen by large number of people. It was saved right as Science Today. It was translated, text was translated in many languages, and the film was made on it. The film was shown on our television program, which was the method of science exhibition. I'm talking 1977 onwards. And it was here in the, also shown in Hyderabad sometime, I think a couple of years. Then there was a statement of scientific temper that was issued by a number of people for very experienced, around Champagne, Narayani Bay, a lot of us, about 40 people signed it. This was debated all over the country, translated in all the languages, all the Jamaican school colleges. These 2 incidents, there's documentation, actually influenced 2 million people, 2 million young people.
This is documented.
This estimate is not. So 2 million people were influenced by it. Their lives were changed. And I keep on running into these people who were students at that time. And now they are in positions. I meet them at the airport and say, Dr. Bhargava, this effort of yours changed our lives. So I think we need more and more efforts.
May I know it's getting late, but I have the need to say a couple of things. I think you have put across the points that you made today extremely beautifully, scientifically and very rationally, naturally, which is your profession. You based entirely on the concept of reason. But you also mentioned somewhere along the line that all truths are tentative. And coming from a scientist to completely nullify something which may or may not be working, placebo or otherwise, a field of experience which perhaps homeopathy is. It may not be a science at this stage. It may need to go through the rigors of putting it through a whole lot of experimentation and verification, but to nullify and drastically declare it dead, which is what you are doing, is drastic. And I just felt that, like many other things, there could be a potential. Granted, it is absolutely doubtless that science has made progress, particularly in the last century, by leaps and bounds. And that, however, and this is another statement that I pick up from your own talk, that we have nonetheless survived the 2 millennia or more. But we have been able to verify, document the progress that has happened. We are actually benefiting immensely in all fields of our life today by the very science that bases itself on rationale. But we have existed these last 2 millennia, and it is now that the product turmeric actually got the copyright, whereas it has been part of our history, part of our tradition. It has been now tested with time and scientifically. So I do take back the questions that you have raised, and I don't want to single out Shireen here or for being somebody who has a whole lot of homeopathy bottles in our house. I am somebody who has faith, period. Faith in X, Y, Z, including science. And I think we do belong together sometimes. It would be incorrect to my thinking to declare it dead. I think there could be potential, I think there could be possibility of working together and working on trying to verify certain things which might be working. And 50% of course of homeopathy does not work, allopathy does not work, we have problems of contamination, every field of science and medicine. Well, I just find it a little drastic, and I just want to show this.
And you know, if you go back to what I said in the beginning about mankind having survived, because it has survived, it must have had cures for some diseases. There's no question about that. And those cures which have been validated, they were perfectly reasonable. I mean, to expect that plants will have chemicals that will act as drugs is a perfectly reasonable assumption. It's perfectly scientific. So there's, if somebody comes to me and says, for example, you mentioned about these antibiotics, I said it can work, except that we must show that it works. For healthy, large number of experiments were done in the early part of the century by other scientists. And they documented, they've done double-blind trials and showed that it works. That's why we were able to find that victim and beat them. For the first time, now, 21 victim 5. So there's nothing wrong with it. Now, when I say something is dead, I say because there is nothing in it which has any possibility whatsoever. And you see, if homeopathy is right, all of science must be wrong. Everything, which cannot be, because it works. That is the whole. There's not even a spark in it. Nothing in it. It is the, if you were to think of limits of absurdity, if homeopathy works, then I think my statement that there exists on this planet elephants with 9 legs also must work. Why should we doubt it? But there must be a reason for belief. There must be somewhere something that, yes, there is a spark. There is nothing. There is nothing in it. Why not we say, why say about homeopathy? Why not about cognimency? Why not about, in fact, I once wrote a letter, and it was published in all the newspapers in this country. I listed from A to Z practices. I got the name of Maheshwari. Right here in Hyderabad, there was a meeting that, to which I was invited by Maharishi Maheshwari to attend. It was small. And I said, you know my views on Maheshwari, so the person, this lady, extremely well spoken, very charming, came to see me. He said, yes, we know the views, that's why we want you to come to this meeting. He says, it's a small meeting. It turned out there were 7,000 people in Lal Shastri Stadium. The entire purpose of the meeting was to browbeat me. And there's a friend, he's C.G. Sudarshan, very well-known physicist, a great follower of Maharishi. So Sudarshan was there. Anyway, that meeting is a part of history because I got after I told him to pigs. And he said that he can levitate, and I said, right in this evening, I'd like to see Maharishi Maheshwari levitating. I'll bring all my machines, we'll see, can he even rise 1 inch above the ground? And of course my challenge was not accepted. So, in fact, the people told me that I could have shot at them. It's all documented. There's an article in the New Quest on this whole history. So, you know, if you say, well, I believe that Maheshwari can fly around in this room sitting cross-legged. Why should we give this a benefit of doubt? My answer is no. If I do that, I'm deceiving myself, and I really don't have the right to be called a scientist. There must be some basis for it, some possibility. If, for example, you say that, well, someday we will be able to, if I put 2 apples here and 2 apples here, someday we should be able to show that they are not 4 apples, they are 9 apples. I don't think it's going to be ever possible. Somebody says, well, you must believe that there must be ways of making these 4 apples become 9 apples without adding or subtracting. I said, no way. I'm right in saying. So you see, there are limits of reason. There are no limits of absurdities, but there are limits of reason.
How do you rate the present scenario of the yoga and the asanas?
No, you see, yoga is a very different concept.
and regularizing exercise. And I think there's a very deep in our system of yogic system of exercise. I have no problem. After when I do some exercise in the morning because I have some, spondylitis in very early stage. I did some of these exercises which a physiotherapist prescribes me because I'm the chairman of some Harvard Trust which runs the clinic for these 6.5 lakh power gas stress lifting. Maybe running, maybe very well. And we have three systems of medicine. We have Ayurveda, we have yoga, and we have one system. And we compare, we need the choice. Because we think there's something, but we don't permit the use of basmas. But we permit the use of plant-based. Maybe they work. We don't know. Some cases we know that they work, some cases we don't know. But it's possible that they work. So we benefit by yoga exercise. We are dependent on application. We are not American Medical Association. Very well known medical. You see, they are excellent system of exercise. And I think it's a fantastic system. And we should encourage it. But if yoga claims that it will cure you of smallpox, then I will say, or of typhoid, or of cardiac, if you have a block, one of the arteries. Then
Regular user of homeopathy from the beginning.
Sorry?
Regular user of homeopathy from the beginning. And he is not having any ailment so far. He is a regular user. Actually, I am my own relative. Because you are saying that they are not having clinical trials, is curing the efficiency of the drug, what are you using? Is only luck or something like that, but not based on anything.
Well, look, I know of a friend.
He never used allopathy as a real case.
I understand. I have a friend who unfortunately is no more. He was in the prime of health till he died. The only shirt he used to wear was red shirt. So was red shirt responsible for his good health? I asked him. He was just one of that. He was a friend of mine. 60 years. Never went to a doctor.
I will have a very short question. What do these homeopaths do? What keeps them busy in anti-fructose?
No, bifractose. And then they keep on busy.
Factory or something where
there is no standards whatsoever. They are the most contaminated medicines that you can buy. You can analyze them for the bacteria. There are no standards.
But they put some chemicals in there.
No chemicals. They only use fructose, or they use, say, if it's liquid, they use water. I think we are only.
Oh, but it smells like some chemical sometimes.
Some of the liquids, yes. They put some
spirit, is it?
A little bit of alcohol.
Oh, no wonder people like it.
Yes. And value it. Use it as a value. See, there's another point that I must tell you that, see, in science, one thing we talk about is tolerance. Very important for a scientist. I'm sure you remember the incident that happened when I was nearly killed. That I was invited to a press conference by some organization. And the press conference was on the national systems of medicine. And I mentioned homeopathy in the national system. And I said, look, I will defend your right to go to a bathroom till my last breath. You have a right to go. I defend your right to practice homeopathy. But not with garments of homeopathy. If you want that you should be paid and you should be reimbursed, that you get out of this. Well, defend your right. It's your right to go to it. I said, next day at 2 o'clock in the afternoon, my office, my colleague Chandra Chakravarti got a call, frantic calls from shopkeepers in that area, and from people walking the street, saying, please back off Dr. Bhargava, send him away from the office. This is what happened. He said there are 500 homeopaths who are now went to in front of CCMB gate and they are asking for Dr. Bhargava. They say we ought to kill him. This was a slogan. Look for murder. That was a slogan. They want to kill him. So, and you know, we were talking about support. My views on homeopathy are known. Among the support I had from that region, that these shopkeepers, people on the street, a group of them went to my house to protect my house. And when these people went to my house, they told them, oh, Dr. Bhargava is not here at the moment, he's out of the house. See, look, his car is not here. Then this crowd came to my office. They broke the gate. Then Chandra went to the balcony and said, Dr. Bhargava, I'm very happy to see you. 4 or 5 of you, there's no problem. But please do it quietly. Not this breaking of him. They broke proverbs. They started throwing stones at her. Does our culture say that a woman standing on the balcony talking to you, you throw stones at her? Is that what the homeopathy teaches you? So she closed the door. My balcony was lit at this time. And then they started breaking the doors, 2 doors we had. So my staff stood against the doors. Fortunately, she had telephoned the police. And since the police people know us, the message went on to all the cells saying, anyone who's close to Dr. Bhargava's office, please go there. If the police was 5 minutes late, I would be here. Is this the way to act? These were teachers of. And once I had a visit of about 20 students from Petty College. These students came to me and said, Dr. Bhargava, I want to tell you, we are taught nothing. We are told not to question anything that our teacher says. Tell us what to do. We spent 4 years, we don't know what our lives is, what is wrong with us. This is true story. Say we are scared of saying anything. But they say that we will be beaten. Is this the way that you run your profession?
My last comment. In our country, Dr. Batra can advertise. And no allopathy can never talk.
No, we have a rule. Medical Council of India prohibits advertisements.
Yes. But Dr. Batra can.
Dr. Batra can, because those rules don't apply.
Yes.
Look, the point is that unless we teach people right from the very beginning how to arrive at opinions, how to take decisions, use reason, scientific method, rational attitude, this kind of beliefs will continue. You don't know how much damage they have done to the society. Irrational beliefs is not only in medicine, in everyday life. Right? Give you an example of nation, give you an example of Satsara. All these bottles. And how many of these bottles have been exposed? The Satsara have been exposed to the film. Doordarshan has a film. I have a copy of the film. I'll show you how it does all these bottles. Right? So you have dozens of people do exactly what he does. And still people go to it. And they rationalize it. I think this is a, even our ministers, the man should be today in jail. The murder is committed in Ashram. All documented. Police know. CBI has told us. But when all your ministers, your judges of the court, well, what do you do? After all, the money that if Sai Baba gives you a suitcase of notes, that's tax-free. No tax needs to be paid. If you give him a suitcase and he does like this and gives you a suitcase full of 50 lakhs, that's tax-free. Yes, absolutely. It's completely tax-free. It's cash you receive. He is converted into nothing. Suppose he gives you gold. After all, and mind you, gives those gold rings only to rich people. And the watches that he bought from Japan, gives it to rich people. But you pay no tax on it.
Thank you, sir, for an exhilarating evening. Ajay has been saying that we have been here in Manthan for quite some time. Really thank you for the evening. Being an expert palmist myself, I can tell you the absurdity of those Jewish. But I enjoy palmist.
So do I, as long as you are the palmist and the person at the other end is a lovely woman. Who would think?
I will tell you how. He specializes in that.
Most palmists are men.
He specializes in that.
I don't blame him.
Thank you for being with us this evening. It was a great introduction to the method of science, which we forgotten as a token of our affection. May I request Shankar to present all coming.
Shankar, I should be giving that a present.
Thank you, sir.
Thank you very much.
Thank you, everybody, and we will meet again next month. Thank you.